Hello, everyone, and welcome to another episode of This Week in ip&O. We are, of course, as always, live from the couch in my living room. Today, we have a special guest. It is Vicente Gracias, who is the Vice President of Health Affairs for Rutgers, the Senior Vice Chancellor for Clinical Affairs at RBHS, and the Chief Academic Officer of Robert Wood Johnson Barnabas Health. Thank you for joining us today. Clearly, by the titles, you are very clearly very clearly a busy man. So, thanks for taking the time and talking to us for a little bit.
Well, Paul, thank you for inviting me. I'm only as busy as everybody else around Rutgers, so unfortunately, there's no place to hide here. And since everyone leads by example, I don't think anybody sleeps at Rutgers these days.
Yeah. So just to get started and to kind of get everyone who's listening familiar with who you are and what you do, can you tell us a little bit about what you do on a day-to-day basis and what your career has looked like over the years?
Sure. I'll try to be brief because it's kind of boring unless you're the one living that life. So, I think it's important for everyone to know that I was born in Madrid, lived in North Africa for a little bit of time, and then my first taste of American life was Detroit, 10 Mile and Gratiot. And maybe you guys may not remember, but Eminem had a movie out called 8 Mile. So that gives you a little bit of background of where I started in America. But as an immigrant, there was no plan B. You either work hard, try to prove your value to this society, or you're back to whatever country you decided to come from. And in many ways, that's really emulated my entire career. It is about working as hard as I can possibly work to prove my value to this country, to this society. But as that career advanced, I realized that there's a lot of people with an enormous amount of value that didn't have the ability or the chance that I did to be able to prove myself. So early on in my career, I was very lucky. My father's a physician. My grandfather's a surgeon. My father's a surgeon. My twin brother's a surgeon. My sister's a surgeon, and I was a surgeon. So for about 25 years, I went through the process of going to Notre Dame undergrad, and then medical school, surgery school or surgery residency, and then ultimately practiced trauma surgery and surgical critical care for about 25 years or so. And at that point, I decided that there was an opportunity in New Jersey to help build the trauma centers in New Jersey that were having a lot of issues at Robert Wood Johnson with one of the level 1 trauma centers in the state. And there's 3 level 1 trauma centers that take care of the 9 million lives, 10 million lives we have in New Jersey. And I was at Penn at the time. They asked me to come over and take a look at it. When I came over to and I've lived in New Jersey for over 20 years. I used to make a left to go to Penn, and now I make a right to go to Rutgers. I took a look at Robert Wood Johnson, and there was an enormous need there, but I also saw a true potential. This was more than 11 years ago now. What I saw was a enormously conscientious community, but a university that was really struggling to try to find its identity. I came because it needed help. And it needed help to try to make sure that it was still taking care of all the patients through trauma and critical care. And that's why I came. I started the first pediatric trauma center in New Jersey. I built and rebuilt the trauma and critical care service lines with many talented people, both at Robert Wood Johnson Medical School and at the Robert Wood Johnson University Hospital. Because of that, and Rutgers tends to do this, if you're successful, they just reward you with more work. When Dr. Barchi showed up and decided to really take this university to where it belonged, which is a Big Ten university, and Brian Strom, who's the chancellor of Rutgers Biomedical Health Sciences, when they came to really help Rutgers seize its true opportunity and destiny as a public university, world-class research university, and world-class education engine for this state and for the country, they took it to the next level. And they asked me to be dean of the Robert Wood Johnson Medical School. I served that as interim dean for almost 2 years. And then I was asked to join Chancellor Strom in the chancellorship, where I became the senior vice chancellor. And we started looking at the organization of Rutgers and what we could do to really make the health part of Rutgers University organized and grow. And at that point, we established the Health Affairs Office at the Rutgers side of the overall university process, and student health, occupational health, and other components that were traditionally part of the overall university, was introduced to a couple other individuals named Brian Strom and Vince Gracias. And together with the leadership at Rutgers that had run all of this for decades, we began organizing it together across the entire university. And that allowed me as one of the focal points to begin to see how we could best address health needs across the university. That includes Rutgers Biomedical Health Sciences. It includes social work, applied psychology, and all the medical schools, dental schools, pharmacy schools, nursing schools. I don't want to miss anybody in school of health professions, and many, many others that are now organized together as one voice. The first time that Rutgers Health was established, and as my career has changed, it's really about giving voice to everyone that really manages patients and learners together. I've been very lucky to work at a university that in my life is malleable. Many people don't get that opportunity. Rutgers is enormous, the largest land grant university in the country. And during these times that over the last 10 years or so, it's become incredibly malleable because it wants to seize its destiny. And I've been lucky enough to be a part of that. The education side or health education side of what I do academically also reports to me. So over the last several years, with the help of the president, the chancellors, and many talented people, we have been able to organize the clinical side in a much more effective approach so that we're all working together, and the education side so that we're all organizing to deliver much more of an interprofessional approach, a interprofessional organization that allows all the learners to be taught in a very different way than we were traditionally taught in the past, where it's a team-based approach and everyone is very interested in what are the best outcomes for the patients. So at this point, I helm the clinical learning environment for Rutgers University, and I've been very lucky enough to also be involved in our response to the COVID-19 pandemic. So a little bit about me, from surgeon to unfortunately administrator, which a lot of people like to call that to me. I used to think it was an insult till I realized just how hard people work on the administrative side. And it's been just an absolute pleasure to grow and to learn as Rutgers has also ascended to just an unbelievable place across the United States. And I've been lucky enough to also be a part of the Big Ten Infectious Disease Committee that was set up to inform and educate the Big Ten football consortia during this pandemic as well. I guess that's enough.
Wow. So, I mean, you mentioned that there aren't a lot of people who get much sleep around Rutgers, but something tells me you get a little bit less than most of us. So that was a very impressive background. And I think to switch gears a little bit here, starting to talk a little bit about the pandemic and the vaccine. The vaccine rollout in New Jersey started at UH up in Newark. And we're just wondering, did you have any role in the logistics of that? And if so, could you talk a little bit about what that process was like?
Sure. Well, I'm just one of many, many people that have helped us defend and begin to vaccinate for this pandemic. So this has been going on for more than 12 months for me now, and it'll continue. In terms of the UH rollout, a lot of what we did through the clinical affairs offices was prepare the registration of our own employees, students, and everyone that wanted to be vaccinated. Since the vaccines are under an emergency use authorization, there is no mandate that everyone is required to be vaccinated. We needed to create a process where every employee that was eligible to be vaccinated had an opportunity to register and to then volunteer to be vaccinated. So clinical affairs started by creating databases with REHS, in order to be able to survey everyone that was part of the tiering of vaccines, tier 1, tier 2, and tier 3. And We're all hearing about that now as we look at who's in 1A and 1B as the state tells us who we can vaccinate. Every time that broadens, those people need to be registered. Before, the New Jersey state had a registration site that opened up just a little bit ago. Rutgers already, through clinical affairs and the help of Rutgers University and RBHS, we developed our own database, we developed our own survey, and we surveyed our own community to make sure that we captured everyone that qualified for a vaccine and that wanted to be vaccinated. All that information was then shared with University Hospital. The relationship between University Hospital and JMS is robust. It's been together in a partnership for decades. And we were able to, with the help of the clinical affairs offices in New Jersey Medical School and the leadership of University Hospital, to quite rapidly establish the vaccination clinics there at University Hospital. We had the databases that we needed in order to consent everyone properly, because this requires an enormous amount of complex paperwork that has to go all the way back to the manufacturers and to the federal government. And then we started rolling out the vaccination clinics at UH. Everyone thinks about the last 4 feet of vaccination, which is where you see a syringe and someone walks to you about 4 feet away and then sticks a needle in your arm. Very important. They have to be trained, they have to be educated, and they got to make your mark and hit your arm instead of someplace else. But there's a lot of work behind the scenes in order to get that vaccine into the hands of the people that can vaccinate you. And these vaccines were incredibly complex. Logistically, they require what we call ultra cold chain storage. These vaccines are stored at between -80 and -97 degrees Fahrenheit. And those are not common logistical equipment that everybody has. You working with the health systems, and particularly in this point, UH early on and Robert Wood Johnson Barnabas Health, we were able to use their cold chain and ultra cold chain ability to begin to vaccinate. And UH and its pharmacy and the school did a fantastic job of coordinating in Newark to begin vaccinating, but also to move the vaccines from the manufacturers into the hands of the individuals that could then vaccinate our community.
So as you were mentioning, obviously the COVID vaccine is very unique in terms of the fact that it was developed in a sort of a record time, and it's the first RNA-based vaccine, which maybe has made some people skeptical. Can you tell us about some of the science behind the vaccine and what you would say to alleviate people's concerns?
That's a fantastic question, Rich. And I think it's probably the one that's most pressing on everyone's minds. So let's just concentrate, if you don't mind, because there's a lot of vaccine candidates that are working its way through phase 1, phase 2, and ultimately phase 3 trials. So they work their way from bench to animal research and then to human exposure. So Pfizer and Moderna, which are the two that are most relevant at this point. Johnson & Johnson's also by the end of January. As we move into February, the data starting to come out now, so there'll be a third vaccine very quickly. The Pfizer and Moderna vaccines are messenger RNA based. So this is a platform that has been used in the past, not across the entire globe because we have to vaccinate, the entire world for this pandemic. But it has been used in the past on Zika and a few other infectious diseases. The messenger RNA vaccine does not touch the human DNA in any way. It's a little protein that gets injected into your system just to try to make this, to illustrate it a little bit more clearly and simply. And then that little protein does go into our cell and creates the spike protein that everyone understands when you see a picture of the coronavirus, those little spike proteins that everyone sees that are around that little ball that is common and probably every cover of every magazine when you see the word coronavirus. That gets made for a temporary period of time on our cells, and our immune system reacts incredibly well to that. So we put in a little signal in the cell, it creates a little flag, our body sees it and says, wow, that's not mine, that belongs to the enemy, and it starts creating an immune response with antibodies and other ways that our body fights off foreign material. And then it disappears. but that immunogenic response, the immune system is so triggered by the messenger RNA that we are seeing the effectiveness of these vaccines jump to levels that we really haven't had before. Greater than 90%, 94.5, 95% effective, which means if you get the injections appropriately, there's a 95% chance that COVID-19 and many of its variants right now, we're starting to understand you are protected from this. So then why not take it? It really has to do with the fear of the unknown. What everyone always talks about is what's the long-term results? And we honestly don't know. We don't know what will happen to you 2 years from now, 5 years from now, or 10 years from now. And that has cast a shadow across the concerns that people have legitimately in terms of the safety of the vaccines. But what I can tell you is that they seem to be incredibly safe. What we do know about long-term results is that when we have a new technological advancement, and I use this example all the time, when the iPhone came out, we didn't have any long-term results in terms of what that would happen if you put that iPhone in your ear. We don't know, but everyone went out and bought an iPhone because you need an iPhone or you need some other type of cell phone as that technology improved to keep up. The same thing with caffeine drinks. All sorts of colas come out all the time. There is no long-term data about, the latest hyper-caffeinated drink that all the kids are drinking in college or in sports to try to keep going. And yet everyone goes to the store and buys them while we wait to see. In this particular case with vaccines, I just wanted to illustrate that long-term results aren't always something people concentrate on. But when you look at the small, tiny risk based on all the studies that have been done to date in terms of what could happen, and it's all hypothetical, what we do know what's happening in the world right now is that more than 2 million people have died. And the risk to us from this virus now is much, much greater than any possible long-term risk associated with these vaccinations. We believe, and that's not just me, but scientists that have dedicated their lives to studying these vaccines, and we're very lucky at Rutgers that not only are we reading the scientific information from around the world, but we're generating a lot of that information. The intellectual property that helped develop the ability to detect this virus, the saliva tests that were developed here, the experts in our laboratories, that a lot of the intellectual property and all of these detections are coming from the experts of Rutgers who understand this virus very, very well. And they believe these vaccines are safe. So I'm giving you ultimately the opinion of everyone at Rutgers that we have access to and the global experts that say the tiny, tiny, tiny risk of a long-term side effect is far outweighed by getting everyone vaccinated so that people can stop dying. And since Rutgers really represents not just the entire community, but also the community of the people that are being hit the hardest by COVID-19, we need to vaccinate ourselves. And this is a trust issue. We believe in science. Rutgers University is now one of the most potent public research universities in the world. And because of the science that we generate, we know that we can trust that science, we teach that science, and I want everyone to understand that I would not be saying that I think it's safe if that science didn't back up the opinions of all the scientists at Rutgers that I just get to be fortunate enough to be able to talk to you guys about. So long-term effects aside, which we really don't know about, but we don't know about a lot of side effects long-term along many things that we use every day, are far outweighed by the known benefit of being vaccinated.
Thank you, Vicente.
That was a great explanation. I'm sure.
Yes.
I'm sure anyone who was on the fence before would probably be swayed by listening to that.
Hope so.
Yeah. So thank you for coming on the show and for explaining all that to us. I think that was really informative. And if there's anything else you want to say, we'll give you the last word.
Well, first of all, I want to thank all of you for continuing to do this. What I know more than anything else is that fear, ignorance, and the ability to sway public opinion is all based on education and communication. The beautiful thing about the university we have is that we can generate an enormous amount of science, but it's individuals like yourselves that actually help communicate that and help educate that to everyone that we're responsible for as a community. So please keep doing this. It's very important. We have to keep repeating it because we are human beings. But ultimately, the community needs to vaccinate itself. If only half the community vaccinates itself, the vaccinations don't work. We have to vaccinate 70, 80% of our entire community, and that includes the United States, it includes New Jersey, and it includes this university to get to what everyone understands now is herd immunity, so that we can stop vaccinating ourselves every year or every however long these vaccines last. And we think the vaccinations last from an immunogenic point of view for over a year. So we need everyone's cooperation. I know there's a lot of fear out there, but if we continue to educate ourselves and people keep tuning into your programs and programs like this, so please don't stop. Our hope is that more and more people will understand that Rutgers is and does have their best interests at heart, and that you can trust our scientific opinion. Thank you all.
Thank you.
Thank you.